Hi, this is Brian Kim. I'm going to share with you case number 6 in the best way to do cataract surgery series. This is a 3 plus brunescent lens. I tend to undercall my cataract, so I would say some might even call this a 4 plus brunescent lens. It has a very thick, fibrous, leathery consistency. I made my stab incision and then went ahead and placed some intracameral epinephrine to stabilize the pupil, some viscoelastic in the anterior chamber, and using that cannula to hold the eye steady. I make my triplanar corneal incision, making a vertical groove, then tunneling, and then entering into the anterior chamber. This is a right eye, and the patient has a tendency to look upward with a strong Bell's reflex. And so rather than using forceps, which can be a little bit traumatic and can cause some stria, I'm using the cannula to hold the eye in place so the eye doesn't move upward. And so I'm doing this kind of two-handed Capsulorhexis technique, using the cannula to hold the eye steady so it doesn't go up to the top of the patient's head. And I'm slowly and with multiple grabs performing my Capsulorhexis, which is around 5 to 5.5 millimeters in diameter. I went ahead and burped some viscoelastic from the anterior chamber before performing my capsular fornix hydrodissection. I'm placing the cannula out to the equator and rotating the right angle cannula downward towards the nerve. You get a nice fluid wave. I'm decompressing the capsular bag and then separating the anterior capsule from the lens and then going on the other side, and I'm beginning to spin the lens. This is a very consistent way to perform hydrodissection, and I do highly recommend this technique. I go ahead and lift the wound with the irrigation off. I go into the eye. Again, I don't like to push fluid because this can cause separation of decimes. I'm removing the surface epinuclear material. And you can see this lens is fairly dense. It does have a leathery consistency. Go ahead and perform the double chop maneuver. Place the chopper out to the equator. And as I do so, I rotate my phaco tip vertically, subincisionally. I'm grasping the lens and I'm crushing the lens between the chopper and the phaco tip. For the most part, this lens is separated, but there is some adhesions to the lens posteriorly. And so I am going to have to perform some extra chopping maneuvers to separate that posterior portion, the so-called posterior plate. And so you see I used a little bit of vacuum to lift the lens right there, and I got under the lens with the chopper, and then I kind of crushed the lens material in a sideways fashion, which separated that posterior segment of the cracked part of the quadrant right there. And so then I begin to start crushing the lens material and emulsifying as I go. You can see, again, I'm using a little vacuum right there and then crushing the lens material. I'm crushing again the lens material between the phaco tip and the chopper. I do take advantage of using the vacuum to help me kind of manipulate the lens material when needed. But again, it's always at the iris plane. I'm not using that vacuum anywhere close to the posterior capsule. So I go ahead and separate the lens a little bit more. I perform another cross chop maneuver with the chopper out to the equator and then cracking that one segment again. You can see it's cracked, but there are some adhesions posteriorly. Again, I'm grabbing the lens with the phaco tip and vacuum, lifting the lens a little bit, and then I'm crushing the posterior attachment between the chopper and the phaco tip, which then allows me to lift that fragment up, and then I begin to crush that little fragment between the chopper and the phaco tip. And you can see I'm just doing that very carefully. I'm crushing and sandwiching. And when I get the lens to a small enough size bit, then I begin to emulsify that lens material. So again, I'm crushing again between the chopper and the phaco tip. And when it's small enough, I begin to emulsify. I grab this other piece and do the same thing, crush, and then emulsify as I go. As a reminder, I don't activate any ultrasonic energy or vacuum during the crushing maneuvers, especially when I'm deep within the capsular bag. And this helps me to avoid any type of problems. And by doing this technique, I haven't had any complications where the phaco tip caused the posterior capsule rupture. So I go ahead and spin this lens. I'm going deep with the phaco tip and crushed that other heminucleus, and then I'm placing the chopper out to the equator again and crushing and chopping this quadrant. I'm using vacuum to lift the lens up a little bit And then I am using the chopper and phaco tip to sandwich, almost like a scissoring motion. I'm crushing the lens material sideways. Again, using a little vacuum to help manipulate the lens material, and then crushing, sandwiching the chopper and phaco tip of the nuclear fragment. Continue to successively crush the lens material, and once it's small enough, I start to go ahead and emulsify the lens. You can see at this point, half the lens is out, and I have less than 1 CDE on this pretty dense lens. And you see, this is all in real time. I did not speed up these portions of the surgery just so that I can show you in real time how I'm doing it. I'm not rushing, I'm taking my time, and I'm very controlled and methodical in what I'm doing. Placing the chopper out to the equator, again, deep placement of the phaco tip, crushing that piece of lens, because you want to make sure the chopper and phaco tip are going to be meeting at the densest portion of the lens material. If you don't place that phaco tip deeply, you're going to only score the surface of the lens, and it's going to be ineffective in breaking that posterior plate. And so when you place that chopper out, you need to place the phaco tip fairly deep in the bag, and then you're crushing the lens and crushing, hopefully, the thickest and central part of the lens material. So this is the third quadrant that has been crushed successively using mechanical fracturing forces. You can see I'm using the chopper and phaco tip to crush this little nugget. You can see how dense it is still, and I'm sandwiching the two instruments to crush the lens material. As the piece gets smaller and smaller, I go ahead and emulsify the lens material. I'm crushing and then emulsifying, crushing and emulsifying. And so we are now approaching our last quadrant, and I'm placing the chopper out to the equator and placing the phaco tip again deep in the bag, and I crush the lens in half. I sandwich and crush these little solid nuggets as I go, and then emulsify as I go as well. So I'm just pushing the lens, going the chopper out to the equator, placing the phaco tip again deep. I'm separating that fragment and then going after this other fragment and doing that scissoring maneuver, and I'm crushing and separating that lens piece as well. So again, you can see, even though it's a lot of action going on, I have a rhythm and a method in how I'm doing this. You see I'm using a little bit of vacuum here to help grab the lens, and then sandwiching that lens material between the chopper and the phaco tip. And when I get to this end piece, I want to be very careful that I'm away from the posterior capsule, and I have the chopper in between the posterior capsule and the phaco tip. I'm crushing and emulsifying, and this is the last fragment here. I position it in such a way that I can crush it again, a deeper placement of the phaco tip, and I separated the lens material, crushing as I go, crushing in between, sandwiching and separating, and emulsifying as I go. This is the last dense piece that I have here. Again, I crush it, but I make sure that when I'm crushing, I'm not activating any ultrasonic energy or vacuum, because one, that's dangerous, and two, there's no purpose. I'm using mechanical fracturing forces. I don't need to use any ultrasonic energy or vacuum during those moves. So now that I'm done, I'm removing the epinuclear material. I come out, the bag is still intact. I'm pushing BSS in the cannula to maintain the anterior chamber as I remove the phaco tip and switch to the INA handpiece. I always start sub-incisionally, removing the cortex. And with this machine, the aspiration vacuum are so solid that I'm able to do the IA without a lot of maneuvering or gymnastics using the INA tip. And the polymer tip is so safe that I feel really confident using high vacuum with this tip. So I go ahead and start to polish underneath the anterior capsule edge. I always like to do this to minimize lens epithelial cells within the capsular bag. I go confidently and polish the posterior capsule as well. Here I'm placing some BSS on a 27 gauge cannula, and I'm pulsing some fluid within the capsular fornix sub-incisionally. Sometimes there can be some dust bunnies some wispy cortical material in the subincisional space. And so I like to pulse that BSS, and that has worked very well for me. I place viscoelastic to fill the capsular bag, and then take out the INA handpiece and switch to the sweep. And I'm polishing some more underneath the anterior capsular surface, first on the left side and then on the right side. With the sweep holding the incision, I place the 3-piece intraocular lens through the main incision. As I deliver the lens, I leave the trailing haptic out and then use a Maltzman to dial the trailing haptic in. I go in with the INA handpiece off and then activate the fluid. I go underneath the IOL and remove the viscoelastic from the capsular bag and then remove the remainder of the viscoelastic material. So as I've said before, this was a 3 to 4 plus brunescent lens. I'm able to take on the posterior plate by using mechanical fracturing forces, and very safely, methodically, I'm able to fracture and remove the lens materials by sandwiching and crushing the lens material and utilizing mechanical fracturing forces, reducing ultrasonic energy and vacuum, having clearer corneas postoperatively. And so to me, this is the best way to do cataract surgery, and I hope this was helpful to you. Thank you for your attention.